Hey guys, so I want to teach you real quick how to do a self-assessment for diastasis recti, or basically abdominal separation. It's helpful to kind of be able to assess yourself from time to time, especially postpartum, to know where you're at, to know how much of a gap you're dealing with, and if your body is ready to do more advanced core work, or if there is still some healing to do. So with your assessment, we're going to be looking for two different things. We want to look for the gap or the separation between the abdominal walls, between the walls of your diastasis of your rectus abdominis. We also want to look for the tension, or how tense that linea alba, or that connective tissue, how tense and firm that becomes when we engage it, okay? So begin on your back in a really relaxed position, and you want to feel like you have good awareness of the full length of your abdomen here, okay? So when we're doing the assessment, we're going to use your fingers coming straight down at a vertical line. You don't want to be coming at an angle with your fingers or coming too far back. You want to come straight down with your fingers. And we're going to use your fingers to determine the width of your gap. So this would be a 1-finger gap if we can fit 1 finger between the wall, 2 fingers, 3 fingers, or more. We're going to check 2 different ways. So the first thing, I'm just going to feel kind of starting about 4 or 5 inches above my belly button. I'm just going to get a sense of what I'm noticing, what I'm feeling. And I like to go straight down and kind of wiggle side to side. And then I'm going to go through my belly button and keep going down toward the pubic symphysis. Now, that's not the full assessment. I'm just getting a feel for the tension. I'm observing. Now I actually want to do an assessment. So all I'm going to do is I'm going to tuck my chin into my chest and pick my head up a little bit. That's enough for things to tense up, just a touch. And now I'm going to press my fingers down. And what I am feeling right now is really barely any gap at all, a little bit right at my umbilicus, but mostly just the firm tenseness of that connective tissue, that linea alba. When you lift your chin and pick your head up, you might feel more of like a groove. That's what it feels like. It just feels like there's a valley or a groove there. Now we can make your abs fire even further and see if we can assess more of the tenseness or that firmness down the center line by tucking your chin, picking your head up, and exhaling at the same time. So we're going to tuck your chin. Now we're going to do the same assessment and see what we can feel, okay? So remember, you're looking for the gap right at my umbilicus. I have about 2 fingers right there, but that starts to really disappear as I go up and as I go down. You might find that you still have 2 fingers, maybe even 3 fingers up and down, but the most important thing is feeling that tension created between the 2 sides, okay? So that is how you do a basic diastasis recti self-assessment. It takes practice and it takes a lot of awareness, so it might take you a few times to get the hang of it and to just feel what you're noticing. But basically, if you do just a little mini crunch with a firm exhale, you're going to feel those core muscles, your rectus abdominis muscles engage, and that should give you a good sense of what size of gap you have there based on finger width, and also the tension or how firm that connective tissue is down the center of the gap. I hope this was helpful for you. Let me know if you have any questions.